Dr. Tabuenca is probably one of the greatest leaders that I've ever worked with. Underneath his humility is it's really hard to get a sense of all the things that he's accomplished. I've been here 5.5 years, and I'm still learning about awards that he's gotten and books that he's published and accomplishments that he's had that he won't tell you.
You know, it's difficult to talk about myself, you know. My father was a surgeon, and my mom was a scrub nurse. So being a child, I thought, hey, I'm going to be a surgeon. I started in 1990 as a resident.
His father wanted him to be a missionary surgeon and had hoped that he would come to the United States and train and then, go back and serve in an underserved community. And, he really embraced Riverside County.
This is my mission field, so I'm a missionary surgeon and a missionary doctor at the county hospital at RUHS. And with time, with my dad becoming more and more familiar, he was in peace that his son, even though working in the U.S., I was fulfilling a mission. This hospital was a safety net hospital to serve the underserved. Hey, we don't care if you have money or you don't have money. We are going to take care of you here.
I think one of the most important things with RUHS is our mission. First and foremost, provide excellent quality care to the people in this region. This is the culture that's established by our administrators and Arnold. It transcends down to the faculty and then down to the residents. And similarly, it transcends to the nursing staff and all support staff. This organization doesn't run just by physicians, as you know, it runs by a team of people.
Even though Dr. Tabuenca has served as our chief medical officer, if you just ran into him in the hallway, you would never know that that's the position he's in.
Because he'll always point to the team. He'll even point back to you and give you credit for things that he did.
Medicine has become so complex that is not an individual enterprise anymore. Hopefully it was less of that in our hospital, but it was more an individual thing. But now it's not, hey, everybody's working for me. We are part of a team, and we're all working together. And I'm working for you as a nurse or, as a technician.
It's impossible to recount all the things that Dr. Tabuenca has done to sort of help build up RUHS. But if you think about our graduate medical education programs, if you think about research and C-Corps,
he's helped build our academia here in all these programs. So there's all these young physicians that are training and learning here because of the groundwork that he laid.
All the physicians who are going to be homegrown and trained within this community, who are going to be serving us and the future patients and generations who live here, you can, circle back and say that he was instrumental to address the physician shortage in this area. This is why I say that everything that you see around you has been impacted and influenced and been flourished by his care, his love for this institution and this community.
I think Dr. Tabuenca is someone who teaches us all on a daily basis what it is to be humble, what it is to be compassionate, what it means to bring your best self forward, and what it means to, love people as they are. So I can't think of a better example of a human being, to lead us in this incredibly important work.
In terms of the growth of institution, our healthcare network, bringing nationally recognized, verified programs to this hospital that serves this community, and also training the future generations of doctors here would have not had happened. So his impact is monumental.
We as physicians, our nursing leadership, our frontline nurses, our doctors and residents and medical students, we've all been equally blessed by having him choose to spend his career here at Riverside County.
And one of the things that I always felt in, different roles that I had, the real successful leader should be someone that when you retire or when you step down for that position, things do not go bad. Actually, things should go better, and somebody will end up doing a better job than you did. That should be the goal. I know that the hospital will move even to higher levels and continue to improve, and that will then fulfill the last part of my goal. Hey, when I'm not in this role, things should continue and do even better.
I was trying to wrap my head around, what he has done. And it basically came down to one sentence. He is RUHS.